Exercise helps us to maintain regular blood pressure, regular blood sugar. Exercise keeps our hearts and our blood vessels healthier, and all of these things are good for the brain. But exercise also appears to have direct impacts in increasing hormones that are important for nerve cell health, also in increasing activity of neurotransmitters that are important for well-being, for cognition, sleep, and other body functions. Exercise has been demonstrated to reduce the risk of developing cognitive trouble. Exercise in people who have the earliest signs of cognitive trouble, which we call mild cognitive impairment. Exercise reduces the likelihood and the rate of progression to later stages of cognitive dysfunction. When we exercise, there is an immediate effect on neurotransmitters in our brain, and our brain does signal that it's loving this. Another purpose is that when we get these flows of neurotransmitters, it increases the likelihood that whatever activity we're engaged in, that we will engage in the future, right? If you liked it, if it felt good. So there's a reward component to it, and actually lowers the threshold for you engaging in that activity. For those who are struggling to get an exercise program going, recognize that the more that you're able to even get some component of that going, the easier it will be over time. We're talking about an average of 150 minutes per week. So, 30 minutes 5 times per week, or 1 hour 3 times per week. And it's a level of exercise that's moderate. So brisk walk, slow jog, a bike ride, a hike. If you want to do a more intense level of exercise, of course, there's no negative to that. And in fact, it might require even less time, maybe more like 120 minutes per week of intense exercise. So even if one is worried about their brain, or if you have a demonstrated brain problem already, exercise can help. It's never too early and it's never too late to apply exercise and the other pillars of brain health.